There were quite a few abstracts being discussed at the World Conference on Lung Cancer this year that show efficacy and durability in shrinking lung cancer, but also have high levels of toxicity for patients. A few of the antibody drug conjugates that appear to be particularly promising, such as those that tackle HER2 and TROP2, fall into this category. Dealing with side effects from treatment can be very difficult for patients living with lung cancer, often leading to poor quality of life and resulting in patients deciding to drop out of a trial or stop a treatment. Efficacy and durability are not the only thing that matter to all patients. Treatment decisions should always be made very carefully and include shared decision-making between patients and their healthcare providers. Just like all people are different, patients have different goals and levels of toxicity that they are willing to handle. While one person might be willing to sacrifice their quality of life in order to shrink their cancer and stay alive longer, another person might favor their ability to enjoy their regular daily activities over very toxic treatment that might make normal life extremely difficult. Healthcare providers need to take the time to get to know their patients as individuals and find out what is important to them before deciding on a clinical trial or treatment together. It is also important to take into account anything we know about long-term side effects, as patients with lung cancer are living longer with the recent explosion in treatments. Some treatments, such as immunotherapy and radiation, may result in significant toxicities down the road. While many of these long-term toxicities can be managed, it's important to increase awareness about the possibility of such late side effects in order to set appropriate expectations for both doctors and patients. Patients need to understand what these late side effects look like, and physicians should be ready to treat them if and when they occur. Studies on long-term impacts of therapy, such as those discussed at this conference, are critical for the future of today's patients.